Tonight, I'm going to ask you all to make a choice. Throughout the evening, you will hear patients and caregivers sharing pieces of their journeys with this disease. They will open their lives up to you and share intimate details about the struggles they face day to day because of scleroderma. My challenge to you is use the skills you were taught, actively participate in the conversations, and allow yourself to think about disease symptoms and management in an out-of-the-box way. Scleroderma is like no other disease you will ever come across in your career, and it desperately calls for collaborative care and sometimes unconventional methods.
On April 13, 2022, the Steffens Scleroderma Research Foundation and its partners, the Scleroderma Center at Albany Medical College, Russell Sage College, and the Albany College of Pharmacy and Health Sciences hosted their 5th Interprofessional Education event for scleroderma. 3 of these events have been live and 2 have been virtual. The Scleroderma IPE brings students in healthcare disciplines together with scleroderma patients and an expert panel of healthcare practitioners. The goals include fostering awareness of scleroderma, teaching best techniques for interviewing patients, and building teamwork skills among future healthcare providers. These disciplines to date have included nursing, nutrition, occupational therapy, pharmacology, physical therapy, pre-med, psychology, and public health. Early in the program is a keynote address given by a patient advocate. Amy Geetson has been our patient advocate for all 5 IPEs. She discusses scleroderma's effect on her day-to-day life, and most relevant to the IPE, what she needs from her healthcare providers.
Over 20 years ago, I was introduced to scleroderma at the tender age of 19. Our introduction was brief and pretty one-sided. The doctors told me I was sick. They shared that scleroderma was incurable, and more than not, it was fatal.
Next on the agenda was a discussion on best practices for interviewing a scleroderma patient. Heather Friends is Executive Director of the Patient Safety and Clinical Competency Center at Albany Medical College.
I'm also a scleroderma patient, which is how I was initially sort of spoken to about this event, and then came up with some ideas of other ways to use what I do for a living every day, which is simulated patient education.
I'm a dietetic intern. Here I'm trying to focus on malabsorption because that can be an issue, any nutritional inadequacies you may have, ways to improve your digestive symptoms. Are you experiencing any GI issues?
Yes.
What kind of GI issues are you experiencing?
I have reflux, trouble.
The next part of the schedule were breakout sessions, in which the students interacted directly with scleroderma patients. At live events, patients joined the students at their tables, virtually in a private chat room.
I was diagnosed in 2007 with limited scleroderma, and for years, my only impact was that I had Raynaud's. And then over time, I've started to see more and more decline of different functions of my body. So.
Hi, I'd be happy to start. My name is Samantha Sattler. I'm a 3rd-year medical student. Nice to meet you both.
Nice to meet you.
My question for you is, you mentioned that you've noticed some changes recently. What symptoms do you use to monitor the progression of your disease?
The program continues with an expert panel discussion. These include practitioners as well as instructors from the included disciplines.
First question that we have is for medicine, and it is, what is the criteria for scleroderma diagnosis?
And I think that's part of the problem with diagnosing scleroderma, that it is this multi-system disease. And so it's not the same as going to a lung doctor with a cough or heart doctor with a rhythm problem. But you're going to a doctor and presenting yourself with a symptom, which is the one that appeared first.
Clinical pharmacist Mitchell Miller has a unique perspective, as he participated in the first IPE as a student and in the 5th as an expert panelist.
Obviously, one of the big selling points with the IPEs is that students from multiple different disciplines are able to come together and sort of interact with each other, work through a case together. They get to learn about each other's respective fields and their perspectives and goals. which is a really invaluable experience. And the scleroderma IPE took this to a whole other level by bringing in real scleroderma patients to facilitate those discussions.
The last official part of the agenda was a second breakout session that again paired students with a second scleroderma patient.
So for example, I remember watching the nutrition students talk to the patients, and I just thought that the way that they sort of navigated the discussion to achieve their sort of treatment goals was really, really insightful. So a really great way to approach the patient. It makes them feel like their opinion's going to carry some weight in the conversation, like they're really being heard.
Before the first 3 IPEs, we interviewed one student from each discipline about their knowledge of scleroderma, and again after the event to gauge what they had learned and how valuable they found the program.
You know, you can read about this sort of thing in a book, you can get a lecture on it in class, but to actually hear firsthand experiences, to see the differences, to see the similarities, that to me is what really brings what I should learn for the future and maybe identifying this in my own practice.
The Steffens Foundation plans to replicate the scleroderma IPE at other national scleroderma centers and clinics. Contact information appears at the end of this presentation.